So we're going to begin our discussion of eating disorders. Now, I want to let you know I've included some extra information that you won't find in your textbook in this section. While you will not be tested on it, I wanted to make sure to give you as much information as I could about eating disorders. So, some general information. Eating disorders are defined as serious maladaptive disturbances in eating behaviors. And if you were to go into the DSM-5, they all fall under that category of eating and feeding disorders. Now, 90 to 95% of people who suffer from eating disorders are female. So that's a 10 to 1 female to male ratio. But that, however, does not mean that men don't suffer from eating disorders. In fact, 4 to 10% of male college students suffer from an eating disorder. 10 to 20% of female college students also suffer from an eating disorder. It is estimated that as many as 30 million people in the US have an eating disorder of some form. They can occur in every single race, religion, and socioeconomic class. So the first one we're going to talk about is the one that people most common associate with the term eating disorder, and that's anorexia nervosa, usually just referred to as anorexia. Now, if you notice, this is a typical image you would see if you think of anorexia, an underweight female looking in the mirror and seeing herself as being obese. So now anorexia, it revolves around the restriction of food and calories, a refusal to maintain a healthy body weight, limiting oneself to only one kind of food like carrot sticks. And I use that as an example because I had a patient who actually did restrict herself to only carrot sticks for 1 year. A fear of gaining weight, distorted body image, just like we saw in that slide previous to this. Frequent monitoring of weight. I had a patient who would stand on a scale 30 to 40 times a day to check her weight. Typically, weight and self-esteem or self-worth are linked in people with anorexia, and typically being underweight when compared to others of similar age and height. However, this is not always the case. There are people who have other signs of anorexia who are not extremely emaciated. So with anorexia, the body can become severely malnourished. It can actually cause body chemistry disruptions that are like that of starvation. For example, basal metabolic rate decreases, glucose decreases, insulin decreases, reproductive hormone levels drop, which in women, the estrogen drops so low that the menstrual cycle stops. In men, testosterone drops and sex drive and sexual function are disrupted. And it's not uncommon for people with anorexia to have a heart attack or have organ failure. Some people with anorexia may restrict food intake most of the time and then have periods of eating too much food, which we call binging, and then follow that up with purging the food from their bodies, usually through vomiting. Most people with anorexia don't even realize they have a problem. Some people with anorexia actually view their low weight and sickness as a badge of honor. These people may do things like wear clothing that shows off their collarbone, their ribs, their bony legs, and things like that. So the next eating disorder we're going to talk about is bulimia nervosa, and it's often referred to simply as bulimia. And it involves purging food from the body in order to reduce the number of calories consumed. Eating a short period of time the amount of food that would decisively be more than most individuals would eat in that same period of time with similar circumstances, we call these binges, and a feeling of a lack of control over food and eating during a binge episode. Now, there are a lot of physical effects and repercussions of bulimia nervosa. Tooth decay and eroded tooth enamel is one of them, severe dehydration, acid reflux, frequent sore throats, ulcers, intestinal distress, electrolyte imbalance. Things like potassium, sodium, calcium, and other minerals might be too high or too low, and that can result in a heart attack or a stroke. People suffering from bulimia often have comorbid substance abuse issues like alcohol abuse. They might also suffer from depression, anxiety, or bipolar disorder. They're typically high novelty seeking and can get bored very easily. People with bulimia, unlike those with anorexia, usually realize that they have a problem. Now, these people might be of normal weight or might even be slightly overweight. So what do these binges actually look like? Well, a person may consume as many as 50,000 calories in a single binge. Some people binge on sweets like cake and ice cream. Others binge on things like potato chips or cheeseburgers. The key thing is that it's usually junk food that is being binged on. Now, these binges often take place in secret because the person knows what he or she is doing is wrong, and feels ashamed or guilty for eating so much, so wants to hide the behavior. Binges can occur once or twice a week, and they might be triggered by negative feelings or perhaps hunger from food restriction. So we've talked a lot about purging. So what actually is purging? Well, it's the removing of calories from the body. For some, purging involves self-induced vomiting. For others, it's an overuse of laxatives or maybe even enemas. For other people, it looks like excessive exercising or fasting. All of this is an attempt to maintain a normal body weight. So diabulimia. This is the next eating disorder we're going to talk about, and this is the deliberate underuse of insulin in people with type 1 diabetes for the purpose of weight control. So in the DSM-5, it's considered part of eating disorder diabetes mellitus type 1, which is any eating disorder that coexists with diabetes. A diagnosis of bulimia might be given, and they might say that manipulation of insulin is the compensatory behavior being used. Approximately 38% of females and 16% of males with type 1 diabetes have disordered eating behaviors. Symptoms and warning signs of diabulimia include things like secrecy about diabetes management, neglect of diabetes management. They don't want anyone to know what they're doing with their diabetes management so that they can't try to correct things, and they might just not give themselves the insulin they're supposed to. They might start to fear low blood sugars. They might have fear or talk of insulin makes me fat. They might have anxiety about body image or strict food rules. They might avoid eating with others so that other people don't know what it is that they're eating. They might have preoccupation with food, weight, calories, and or blood sugar levels. They go in and their A1C might continuously be at 9.0 or higher. Fatigue or increased sleep and increased diabetes symptoms are also symptoms of diabulimia. Now, there are a lot of significant health issues that can occur as a result of diabulimia. Things like retinopathy, peripheral neuropathy, kidney disease, liver disease, heart disease, coma, stroke, or even death. Diabulimia can actually increase the risk of death threefold. So next we're going to talk about binge eating disorder, or BED. This was added to the DSM-5 as a new disorder, and it's believed to be the most common eating disorder in the United States. It's estimated that 2.8% of adults in America will suffer from binge eating disorder in their lifetimes. Like with binge eating and bulimia, they tend to eat a large quantity of food in a single sitting. But unlike in bulimia, there are no compensatory behaviors. People with binge eating disorder are often overweight. So the symptoms of binge eating disorder include eating even when full or not hungry, eating alone or in secret in order to avoid embarrassment, eating an unusually large quantity of food in a specific period of time, eating much more rapidly than normal, eating until uncomfortably full, feeling disgusted or ashamed of oneself, or feeling guilty after eating, a feeling of lack of control related to food or eating. So all this can lead to being overweight or obese, which can increase the risk of type 2 diabetes, stroke, and or heart disease. Binge eating disorder is often comorbid with anxiety and or mood disorders. So next is orthorexia nervosa, or orthorexia. So this is not recognized in the DSM-5 as its own eating disorder. It falls under the category of eating disorders not otherwise specified, which we often call EDNOS. Unlike the ones we've already discussed, the focus of orthorexia is not on weight. This is an obsession with eating only food that that person views to be pure or healthy, and it's that person's view of the food. It often starts with the person just trying to become healthier, but then it becomes an obsession. So symptoms include things like an increased concern about the health of the ingredients of the food, compulsively checking the list of ingredients or nutrition labels, cutting out multiple food groups like all sugar, all carbs, all meat, all dairy, etc., a refusal and the inability to eat anything except a narrow group of foods deemed healthy or pure, spending hours a day thinking and worrying about what foods may be served in an upcoming function or meal. It becomes like an obsession for them. They need to know exactly what foods they're going to be eating and if it fits into their allowed food list. So since there is no formal diagnostic criteria and no formal orthorexia diagnosis, it's really difficult to get an accurate estimate of just how many people are suffering from orthorexia. Rumination disorder. So this was first listed as a disorder in the DSM-5, so something relatively new. And in this, a person voluntarily regurgitates food that he or she has already eaten. Now, the food is either re-chewed and re-swallowed or else it's spit out. And this usually takes place within the first 30 minutes after eating. So it can develop in infants between 3 and 12 months old, and in those cases, it often disappears on its own. When it occurs in children and adults, it's far more serious and typically requires treatment. When this occurs in children, that child may be deprived of the nutrients needed for proper growth and development. So some of the symptoms include repeated regurgitation of food, and that food may be re-chewed, re-swallowed, or spit out. The regurgitation is voluntary and not due to any medical conditions. Weight loss, tooth decay, bad breath, and frequent stomach aches are all included as symptoms. It's most commonly found in people with developmental disorders, intellectual disabilities, stress, or anxiety. So causes of eating disorders, what causes these things to occur? Well, there are biological causes, things like low levels of the neurotransmitter serotonin. There's genetics. Research has actually shown that 50 to 80% of the risk for anorexia or bulimia is genetic. Now there's also psychological. For example, eating disorders are often comorbid with things like major depressive disorder, substance abuse disorder, personality disorders, obsessive compulsive disorder, or anxiety disorders. It's estimated that 33 to 50% of those with anorexia have a comorbid mood disorder, and about 50% have comorbid anxiety disorder. Perfectionism is another key thing. The need to either only eat perfect foods, or the need to look perfect, or or perhaps it is just a need to always feel they're doing the perfect thing can lead to the development of an eating disorder. A feeling of a loss of control. If a person feels that he or she has no control over anything in his or her life, that person might resort to controlling the one thing that can be controlled, and that's food. Poor body image. How a person feels about his or her own body. For example, if a person feels that he or she was born into the wrong gender, feels overweight or disproportionate, or just has a different idea of what someone should look like. All that can lead to controlling food in order to get the correct body image. And then, of course, there's the societal, and this is the nurture side of nature versus nurture. Family comments about a person's weight, even as a child, or the modeling of inappropriate food behaviors by parents or their family members, teasing or bullying about one's weight. And of course, with the increase in cyberbullying and everyone needing to have a picture-perfect life on social media, more teenagers are developing unhealthy eating. There's trauma and abuse. For some, trauma can lead to a person feeling unworthy of food. For others, the thought of, if I looked perfect, this wouldn't have happened, seems to take over. Lack of friendships and social support can cause eating disorders. Some people have actually reported turning to eating disorders, particularly binging and purging, after feeling bored. For others, they hope they can make friends if they lose weight and look more attractive. And our Western culture actually has the attitude that thinness and dieting are what we should all strive for. So a few important things to know about eating disorders. Eating disorders have the highest mortality rate of any mental illness, meaning more people die of eating disorders than anything, including MDD. At least one person dies as a direct result of an eating disorder every 62 minutes. 5 to 10% of anorexics die within 10 years after contracting the disease, and 18 to 20% of anorexics will be dead in 20 years. Now, eating disorders are treatable. It's also important to note, however, that not all physicians understand eating disorders. In fact, some physicians can give patients poor advice and lead them to unhealthy eating habits and lead them into eating disorders.